we have natural buoyancy from our lungs. That our lungs is our life preservers, because anytime you go down into the water, you're going to come back up. The water will push you up because you have lungs.
So welcome back on Pediatrics To-Go. I'm Francisca Lename, your co-host and facilitator. I'm here with Dr. Ekuase Sanusi, and she's going to be talking to us about swimmer's ear in children. And this is where, it's very, very common amongst children that swim. And this is summertime, so yeah, so she's going to give us the details about swimmer's ear. So, yeah.
Thank you, Francisca. We're going to talk about swimmer's ear, and the reason is summertime is here. Yay! We're having fun. A lot of children are going to the beach. A lot of children are swimming in lakes. There's a lot of pools. In North America, pools are open for recreation, especially if you live in a neighborhood where there's a neighborhood pool. If you have a swimming pool at home, that's great also. But
in Nigeria, we have summer every day.
In Nigeria, people swim every day. Exactly. And it's amazing, but the water in the swimming pools here are nice and soft because it's soft water. Love it.
Really?
Yes. So swimmer's ear is common in children when they've gone swimming, especially in the lakes and just in a very crowded pool. When children go swimming, remember that the water from the pool gets into the external ear. And when it gets into the external ear, sometimes there's bacteria in the water, because whether it's in the lake or a swimming pool or in the ocean, whenever we get water into our ears, there's bacteria in that water, and that bacteria can actually stay in the skin and start burrowing in the skin and cause pain. So swimmer's ear is actually infection of the external part of the ear, which is the ear canal. And anytime you press this part of the ear, which is called the tragus, children scream because it hurts so much. And that's how we know the difference between swimmer's ear. No, most times it doesn't swell. But when we look in the ear, there's usually almost like a waxy film over the eardrum, and the skin of the ear, the external ear, where wax is usually red. And when you press, sometimes there's pus coming out of the ears because the external ear is infected. Yes. So the diagnosis is made by history and physical. You look at the ear. The eardrum sometimes looks totally normal, but there's a lot of pain in the external ear, the skin of the ear. So
sorry, does it itch?
Sometimes it itches, but it's more pain. Anytime we have pain, usually that's signifying an infection. So when children are complaining about ear, some children have both inner middle ear infections and outer ear infections. But when it's swimmer's ear, usually it's on the outer part, and when you press it, or if you pull the ear, they scream because it hurts. So what we usually do for swimmer's ear is antibiotics. We do antibiotic ear drops. You put the ear drops into the ears, depending on the brand. We do a lot of fluoroquinolones like Cipro or Fluoxacin, and we put those drops into the ears, usually twice a day for like 7 days. Sometimes we add steroids to it, like your Ciprodex and other ear drops. When you put those drops in there, if it's really severe, we put a wick, and the wick looks like a little piece of string. And when you put the drops in there, it keeps the drops in the ear canal longer, so that the antibiotics can work more effectively. They are called ear wicks. So sometimes if the child is really in a lot of pain, we do that. Sometimes we treat with oral antibiotics because it's a skin infection of the external ear. And if ear drops are not enough, then we do antibiotics, and we also give ibuprofen for pain. So we usually recommend that for the future, especially if children are swimming every day, they can use earplugs, or moms can use a hairdryer, or dads can use hairdryer to dry the ear so that it dries up the moisture in the ear, and that decreases the risk of bacteria getting into the skin and multiplying and causing an ear infection from swimmer's ear. And that's why it's called swimmer's ear, because it's very common and it's something that happens.
I don't think I've ever experienced it before.
Well, if you swim a lot, sometimes you would. Okay. Do you swim a lot?
Trying to remember high school days. I don't think I ever.
Well, that's good. Some children never get it. Some children always get it.
But what's the worst case scenario if it's not detected in time?
Just a lot of discomfort and pain. And the body, the immune system will fight it. Well, why be in such pain if you don't have to be? So it's better to get it diagnosed and treated early. And ear drops usually is sufficient, especially if it's diagnosed early. you do the ear drops, everybody's fine, and the children go back into swimming. If you can't get the earplugs, there's all kinds of homemade remedies with vinegar, or some people say put alcohol in your ear, but I like the vinegar, half water, put it in your ears to minimize bacteria sitting in your ear canal and causing swimmer's ear. But if you have ear pain, or if your child has ear pain and has been swimming, see your doctor so that they can treat for swimmer's ear. And if it's not an external ear infection, it could be a middle ear infection, especially if your child has had a cold. Then you want oral antibiotics, because if you give only ear drops, it's not going to work. So a good history, a good exam, and your child will get treated and can be back to enjoying the summer fun in the nice lakes and rivers and pools and doing all the diving and everything. And swimming is a life skill. Like a lot of children, they are taught how to swim early. Some of our patients in North America, by the time a child is 6 months old, children, babies, they don't have fear. They jump inside the water.
They always throw them in with the floater.
Yes, always have your child. Even if your child can swim, make sure your child has floaters, and even like some of these swimming suits, they have like jackets.
Life jackets.
I remember somebody saying that we have natural buoyancy from our lungs. That our lungs is our life preservers, because anytime you go down into the water, you're going to come back up. The water will push you up because you have lungs.
Yeah.
And a lot of times, I watched a documentary where there was some old people swimming, and all they did was they just lay down in the water like they were laying on their bed, and then they looked up and they started swimming.
Oh, yeah.
And I did that. And I'm like, yeah, I can swim. And I actually know how to swim very well on my back. As long as I'm looking at the sun and I'm relaxed, the body just goes up like this. Wow. And you stay up and you can float for 25 hours if you want. Wow. But that's just a very passive way of enjoying the water. Mm-hmm. But I always recommend to everybody, it's a life skill to know how to swim. Please, 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 if you do not know how to swim, go and learn, because it's a whole lot of fun, especially when you don't have fear of water and you can jump into any lake. You don't care about how deep it is, and you can just have fun. Yeah, if you don't care how deep the lake is and you don't have any fear, that's a life skill. If you're ever in a boat and, God forbid, or heaven forbid, the boat capsizes, you're okay. You'll be all right. And swimming is not really rocket science. If a 9-month-old baby can learn how to swim, so can just about everyone. And it's really about fear and fear of water. And you need to conquer your fear. Some Ivy League schools and some colleges, if you don't know how to swim, swimming laps, at least 1 or 2 laps, is part of the graduation requirements.
Wow.
Yes. So if you don't know how to swim and you're in an Ivy League college, you might be there for an extended period of time. So go learn.
Till you learn.
Yes. Wow. So you need to go learn. In the past, in the old days, that was a requirement. And I think some colleges still, that's a requirement too. Wow. One of my children told me that to graduate from her Ivy League school, she needed to learn how to swim. Now, I'm not sure which one it was, because I don't want to say it was the first or the second one. But that was a requirement. And they had to learn, and it was part of their grades for passing.
Wow.
Yep. So please learn how to swim. And if you have swimmers ear, get it treated. And we're always happy to see you at Pediatric Partners in Victoria Island in Lagos, which is where our practice is. So come work with us, come see us. And there's a lot of us ready to serve you and to take care of your child. So thank you for listening, and thank you. Please subscribe to our YouTube channel.
Yes, please.
And we'll see you next time.
All right. Bye.
Bye.